Welcome back to Radiology Made Easy. Today we have another fascinating case to test your diagnostic skills. Let's jump right in. Our patient has sustained an injury while horseback riding. Let's examine the imaging findings. Take a look at this frontal radiograph of the shoulder. Notice the positioning and any abnormalities. Pause the video and examine the image closely. What do you see? Excellent. Now, let's describe the findings together. The frontal shoulder radiograph shows an inferior dislocation of the humerus, H, relative to the glenoid, G. This type of dislocation is characterized by the superior surface of the humeral head pointing inferiorly and not in contact with the glenoid fossa. Based on these imaging findings, let's move on to the differential diagnosis. Take a moment to think about what this could be. Great. Now let's discuss the differential diagnosis. Our differential diagnosis includes luxatio erecta, anterior subcoracoid dislocation, and subglenoid dislocation. Luxatio erecta is represented by inferior dislocation of the shoulder, with the superior surface of the humeral head pointing inferiorly and not in contact with the glenoid fossa. This fits our patient's presentation well. Anterior subcoracoid dislocation is the most common anterior dislocation, where the humeral head sits inferior to the coracoid process. Subglenoid dislocation is the second most common anterior dislocation, where the superior surface of the humeral head is positioned inferior and slightly anterior to the glenoid fossa, with the shoulder arm adducted. Given our patient's presentation and imaging findings, luxatio erecta is the most likely diagnosis. Excellent. Let's delve into some essential facts about this condition. Luxatio erecta is a rare injury sustained when an axial load across an extended arm results from a direct force above the head. As a consequence, the arm is fixed over the head. Inferior capsular damage and neurovascular injuries can occur. Fractures of the coracoid process, acromion, inferior glenoid fossa, and humeral head have been described. Before we wrap up, here are some pearls and pitfalls to remember. Patients with this injury exhibit a unique clinical presentation. The forearm is pronated and resting on the head. The humeral shaft is parallel to the scapular spine on the frontal radiograph. Be careful not to misclassify this injury as a subglenoid anterior dislocation. Keep these tips in mind. Thank you for joining today's case discussion on Radiology Made Easy. Keep practicing and you'll be well prepared for your exams. Stay tuned for more cases in our series. Until next time, happy studying.